Why are advanced imaging technologies key for bone cancer diagnosis? Imagine trying to solve a puzzle with only a few pieces. That's what diagnosing bone cancer can be like without advanced imaging tools. These technologies give doctors a detailed look inside the body, which is crucial for accurate diagnosis and treatment planning. When someone shows symptoms like persistent bone pain, swelling, or unexplained fractures, doctors start with a physical exam and review medical history. But these steps alone can't confirm if a tumor is benign or malignant. That's where imaging comes into play. The first imaging test often used is an X-ray. It's quick, non-invasive, and helps spot obvious changes in bone structure. X-rays can reveal areas of bone destruction, abnormal growths, or unusual mineralization patterns. Sometimes, these findings are enough to suggest a diagnosis, especially if the tumor looks typical for certain bone cancers. However, X-rays have limitations. They might miss early or subtle signs, and can sometimes make benign conditions look like cancer or vice versa. To get a clearer picture, doctors turn to more advanced imaging like computed tomography scans and magnetic resonance imaging. Computed tomography scans produce detailed cross-sectional images of bones and surrounding tissues. They help determine the exact size, shape, and location of a tumor, as well as any bone destruction or abnormal mineral deposits. Magnetic resonance imaging offers even more detail, especially about soft tissues around the bone. MRI can show how far the tumor has spread within the bone and its relationship to nearby structures like muscles, nerves, and blood vessels. This information is vital for planning surgery or other treatments. In some cases, doctors also use bone scans or positron emission tomography scans. Bone scans involve injecting a small amount of radioactive material that collects in areas of increased bone activity, highlighting potential cancer sites. Positron emission tomography scans detect areas of high metabolic activity, which can reveal cancer cells even before structural changes appear. These scans are especially helpful for identifying whether the cancer has spread to other bones or parts of the body. Ultrasound is less common for bone tumors but can be useful for evaluating soft tissue masses near bones or guiding biopsies. Newer techniques like ultrasound fusion combine live ultrasound with MRI or CORT images, providing real-time, detailed views during procedures. Advanced imaging does more than just find tumors. It helps distinguish between benign and malignant lesions by revealing features like tumor margins, patterns of bone destruction, and involvement of surrounding tissues. These details help doctors understand how aggressive the tumor might be and decide on the best treatment approach. For example, certain imaging features can strongly suggest whether a lesion is cancerous, guiding further steps. While imaging provides a lot of valuable information, a biopsy is still necessary for a definitive diagnosis. During a biopsy, a small tissue sample is taken from the suspicious area and examined under a microscope. Imaging guides the biopsy to ensure the sample comes from the most suspicious part of the tumor. This combination of imaging and tissue analysis provides the most accurate diagnosis. Even after diagnosis, advanced imaging continues to be important. It helps monitor how well treatment is working, detects if the cancer comes back, and guides additional interventions. The information from imaging studies helps tailor treatment plans based on the tumor's type, size, location, and stage. In summary, advanced imaging technologies are essential for diagnosing bone cancer because they provide detailed, accurate pictures of bone abnormalities, help differentiate benign from malignant lesions, guide biopsies, and support ongoing treatment monitoring. These tools, used alongside clinical evaluation and tissue analysis, form the backbone of modern bone cancer care. They enable early detection, precise staging, and better outcomes. Always remember, each patient is unique, so it's important to work closely with healthcare professionals to determine the best diagnostic approach for individual cases.